So we're not doing her lips just yet, but I'm going to put a little bit of numbing on so we can get her numb when we're ready. So smack your lips together and rub it back and forth a bit. Okay. All right, perfect. And then open. I like to put a little bit of numbing also in here.
Mm-hmm.
It's flavored bubble gum.
Mm-hmm.
And it's a little bit much. If you need, I don't know, a little, and you can close your lips, but if you need to wipe, I'll give you this little gauze. Just hold on. I'm just going to change my clothes because I have too much numbing on them.
Should I not swallow them?
It doesn't matter. I mean, it's just
doesn't?
like when you, it's like when you go to the dentist and they put that numbing in your mouth, getting ready to fill a cavity or something.
Okay.
And your tongue will get a little numb, the throat, but it's fine. All right, perfect. So here, tuck your lower lip in, like, yeah, perfect. Oh, I just broke that pen, and I don't have, anyway. Is it? Perfect. So to fill her chin, she's got a nice apex or the point of her chin. A lot of women, men too, but since most of my patients are women, you'll start to see where they've lost bone, they've lost fat, and the chin almost becomes recessed. She has a beautiful profile from the side. I took her pictures, and the bridge of her nose is in line beautifully with her chin. So she really doesn't need it at the apex. However, she is hollow here. So we're going to work on filling this and this. And then also, I probably just would do a half syringe each side. Also, just where her jaw kind of comes in a bit here. And especially this side, her right side is more caved in. This will help give her a smoother jawline, and it will help lengthen the jaw. But yeah, most patients I have to inject here too, but on you I do not. It looks very nice. All right, so let me get some filler for there, and my cannula. And turn to the left. And this is also a superficial injection, and because of that, you know, using the cannula can really help reduce bruising. And sometimes, I mean, it can feel a little pokey. I'm just going to keep my finger here. Are you okay? So where I see these depressions, I'm going to put some filler. Just a little bit more here. And I'm going to save the rest for the other side. Nice. And let me get my other. Hey, Maddie, can I hand you that 22 gauge candula right there? Please.
This one? Yeah, I guess some
No, it's still
Oh.
like that. It's still like that. Yeah. No worries.
Oh,
No
this
worries.
one.
Yes, thank you. Go ahead and look to the left. And also this is a superficial injection, it's sub-Q. But I'm focusing really right here, just to give her some better definition for her jawline. You okay?
Mm-hmm.
I keep my finger down, I don't want it to drop toward her neck. So the whole idea is to give her a better profile, crisper jawline, and I can mold this. This is Voluma, and I can mold it. Might even put a hint back up this way. Beautiful. Let me take a look at you. Mm-hmm. Nice. Alrighty, it's a smoother transition from her cheek to her chin. And I'm going to do some velour up here after I finish the left side, and that will help smooth out the marionette and here. Alright, perfect. Let me go to the other side. Maddie, when I come over to that side, if you can just dab a little bit over there, that would be great. Although maybe I'll get it right now. Beautiful. Hand me that mirror, Maddie, just so you can see before I. It looks so good. See how this is still sunken? You have these little lines.
Mm-hmm.
It's just so smooth, and then this is a crisper.
Mm-hmm.
Beautiful. Very nice. All right. Seriously, it's so beautiful. I love to have patients take a fast look, you know, at times when I'm going from side to side. Your face just looks brighter. It's just gorgeous. All right. So go ahead and look right. And you've been pretty comfortable through all this?
Mm-hmm.
Sure. Yeah. Okay, perfect.
Very.
know Maddie's here, but generally when I'm injecting, I don't have an assistant. So you're kind of seeing it really true to life right here. People are a little squeamish, but it's a little bit of blood, but some people can't tolerate even the least bit of blood. So I apologize for that. Sometimes it's just getting in and it can vary side to side. There it goes. So I keep it superficial because we're trying to volume lines and not affect movement of her muscle. Still doing okay?
Mm-hmm.
Perfect. What I have found is when I do inject patients' chins, that it actually helps open up their lower lip. We're still going to put a little filler in the lip, but I have found that to be the case. Especially, now, Tammy isn't as caved in as some people. Some people, I'm putting 2 full syringes, even 3, in their chin. Those people definitely, I see the chin like blossoming, the lower lip blossoming open. Okay, so let's work on her jawline here. One thing I have noticed over the years is that it seems like women in particular tend to hold a lot of tension in their jaw. And I tell patients all the time to think about keeping a slight separation in the lips, trying not to bite the molars together. It can go a long way to help preventing some of the lines and so forth that I see here, and the expressions that kind of get ingrained on our face, the tense expressions. Sometimes I have to make everything just a hint bigger. I don't touch my cannula. I don't touch it because that's going under the skin. It has to stay clean, sterile. I'll go in front. And again, I like to mold. This is a superficial injection. Now this side wasn't quite as deep as the other. It wasn't quite as scalped right here. Turn toward me, sweetheart. But what's funny is this is a little bit deeper. I might take a little bit of this. Let's see about moving it up here. I just have to back out enough so I can reposition my cannula. Easy. Keep it superficial. Perfect. And that way it just rides like right under the skin. and I can get a little bit of support here for her marionette line. We're not symmetrical. We tend to not be symmetrical. It could be genetics, it could be aging, like sun exposure. Usually the left side is worse than the right due to driving, like on the driver's side, the sun exposure. Sometimes depending on how people sleep, if they sleep more on one side than another. Yes. Oh, that is so much nicer. Beautiful. Let me have that mirror real quick. Gorgeous. Look at you. Gorgeous. Beautiful. Nice. All right. Perfect. So, let me go ahead and pass off these needles, and we'll get ready to do a little bit of the nasolabial fold. What's a little bit left, and a little bit, we'll put some velour in the marionettes. You still feeling okay?
Yeah, feeling great.
Let me just hand this just like that.
Put them in here. You don't need to do
Yeah.
anything.
Let's ignore that one. That's just a cap cover. I'm gonna change my gloves anyway. So that was another thing. Let's change my gloves. So far, 1, 2, 3, 4, 6 syringes. All right, let's see what else now. Let's do the velour. Let's put a little bit what remains of this nasolabial fold, and then I'll also do a little bit for the marionettes. It's crazy that little crayon. Of course, stuff like that's gonna happen. How are your lips feeling?
No. Very numb, yeah.
Alright, so now I'm going to inject what's remaining of her nasolabial folds. And see again here, she's not symmetrical. This side's a little bit deeper than this. And now though that I put a little bit of that voluma here, that marionette is less. But it's beautiful. I'll probably do like, I try to, in my mind, sometimes I talk out loud about it, it depends on the patient and how comfortable they are with hearing details, but I'll probably put a hint more on this side, maybe still a hint more on this side. So 0.3, 0.2, 0.25, 0.3. So probably 0.3, 0.2, 0.25, 0.25 like that. Okay. And this is done with a needle. Now, if people have pretty substantial nasolabial folds or marionette lines, a lot of times I'll pre-fill them with a cannula, like how I did this one. When you use a cannula, it's more about volumizing in general, whereas the needle is more specific. So, easy. Now this one is a very superficial injection. there are arteries very nearby, so that's why I keep it very superficial. Sometimes filler will come out of a pore. It just happens, especially around the lip. We see that, but yeah, so it's just wanting to come out of your pore. That's okay. Not a big deal. We just stop. Already it looks so much nicer. So now we'll come to this side. So there's my 0.3. Easy. And again, there's lidocaine here. And so sometimes filling the nasolabial folds a bit actually helps with the upper lip. Opening that up a bit. Beautiful. Looks good. Let me take a look. Nice. And I don't like to overfill because I know the products will plump up some. And it's always better to be slightly underfilled than overfilled for sure. Doing okay?
Yep.
Nice. That's better. Beautiful. Open your mouth just slightly. Yeah, perfect. That's all. Let's see. That's good. Maybe a little bit more on that side. Gorgeous. Sometimes when you're doing the nasolabial fold, you have to, especially the marionette lines, you have to kind of put a little bolster, like a triangular structure with filler, just to help finish supporting it. So you don't inject behind it, you'll always inject in front. And here, let's see. Alright, so one more time. Just coming back over. I just have the last little bit of this for more. And again, I'm going to do that little bit of a bolster. You okay? Perfect. Nice. All right. Let me get rid of this. Change my clothes. And so let me clarify, at least just for you, Do you just want the lips just subtly enhanced, not necessarily a full lip?
I don't want like huge. I wouldn't mind full.
Okay. Well, then we can do the whole syringe of the Volbella, especially the lower lip. She has a lot of lines in it, so that tells me at one point it probably was fuller. And it's collapsing on itself. Okay, perfect. This is not a filler that will create a massive lip. It's Volbella 1 mil versus a Juvenile Ultra when I have clients who definitely want a pretty substantial lip.
Right.
That is the one I tend to use. Good. This looks very nice, very natural. I really don't like my clients, unless that's what they want. I mean, I don't like them to necessarily look done per se. I mean, some people, they like that look, and that's fine. I will do what the client requests, but at the same time, I like to just try to enhance their natural beauty, personally. All right. So, do your lips still feel pretty numb?
They do.
The lips are definitely a sensitive area.
Yeah.
I'm not going to lie.
I've heard that.
Yeah, I'm gonna put your hand down just so I can have access. That's better. Okay. I like to, and I barely put any in. It's very superficial. You're doing super.
If you need the hand at any point, I'm here.
I barely put any in here. This is just to help recreate her normal lip line. I stay very superficial. Okay. Come over. Now the lips, I do tend to go back and forth quite a bit, but that's just me. And again, of course, this does have numbing in it. Here we go. 1, 2, 3, 1, 2, 3. Turn to the right a little. Now I have patients, especially younger patients, that they probably don't need the enhancement of the lip line. We tend to lose this, what's called the white roll, as we age. Good. So that's just helping to recreate her Cupid's bow. Leave some of that alone while I work down below. Do you get cold sores at all?
No.
Okay, perfect. I do like to ask patients, usually if someone comes in for a consult, I ask them then if I know we're going to be doing the lips. And then I give them a prescription. However, if they show up and we're just they show up for filler, and they say, oh yes, I want my lips injected, well, then I'll send them home with a prescription if they have the history of the cold sores. Just because putting the needle in the area, it can traumatize, and you can end up getting an outbreak of a cold sore. A lot of people aren't even aware that maybe as a child they had cold sores.
Mm-hmm.
Either they weren't told, or it happened so long ago, family members just forgot, and the first time that they notice a cold sore is when they get traumatized, say with an injection. Still doing okay?
Uh-huh.
Look at you. Let's see. Nice. I do like to do a little bit of a picket fence little picket fence technique. It does help add a little volume. It adds a little volume, and then at the same time, it helps to draw the lip open without making it necessarily protrude. Good girl. Oh, so we're about at half the syringe. I probably will end up doing more in the lower, and your lower lip is definitely going to start getting even more numb.
Okay.
But let me put a little bit in the upper lip, and believe me, it might feel at times. Look to the left a bit. That's it. There you go. Like, oh boy, I'm going to get a really big lip. It's just because the lips are numb.
Mm-hmm.
And they'll feel bigger than what they truly are.
Yeah.
This is not a deep injection. And actually, while I'm here, I'm going to put a little more right here. Oh, let me come to this side. Nice. Look to the right of it. We're almost done. So as I put in, you can basically see where my needle is. This is not a deep, hang on, it's just getting a little grabby. I'm going to switch. Can you hand me the tray and also that little cap? Sometimes there's another needle, and then that little cap right there. Sometimes these needles are so fine that they tend to get a little grabby. So I sometimes have to switch them out midway. But we're almost done. We're almost done. Nice, beautiful. It definitely does not look too big or unnatural.
Okay.
All right, turn to the right a bit. Okay, let's finish over here. All right, let me watch you pucker. I know it's hard with the numbing and smile. I need to do a little bit more on this side. Good girl. This will just help to draw that lip up a bit. Again, without adding too much protrusion. Pucker again for me. I want this. Okay, relax. Pucker one more time. Perfect, relax. So she doesn't really have a lot of lip lines, but what I do see is when she goes to pucker, that this skin caves in. And that can look unnatural, like when you're talking or something like that. Open your mouth slightly. That's the girl. I just want to bring out this oral commissure a little bit more. I'd like to get these corner lines. Pucker again. Let me watch that. Okay, relax. But this will also help prevent the lines. And then I just look for areas that don't look, say, natural, like she was a little bit caved in right here. So just bring that out when you come over to that side. Beautiful. Now let me watch that puckering again on this side. Not too bad, not too bad. Do it one more time. Relax. Open up your mouth slightly. That's it. And that helps turn the corner of the mouth up. Still feel pretty comfortable? I just see still some more of those little wrinkles. Open up slightly. Now I still have just a little bit left, but I'm going to have you, wait, pucker. Relax, I see. Just want to have you take a look. Just see if she is the one that will live with her lips. And just, is there anything that stands out? Beautiful. You can pucker, smile, and I know you're not puckering, right?
Oh, right.
And
Yeah, this, you were kind of able to get rid of that, huh? 'Cause that little bump.
all those bumps, right?
Yeah.
It just,
I was
by
born-
filling the lip, but I could maybe put a little bit more in there. There's that one little
Sure.
bump. You know, didn't want to promise,
Yeah.
but I saw you had several bumps. Tammy had several bumps, and I wasn't sure if it would go away when we filled your lip. But look at, now you just have about the one. Pucker, let me watch that. Okay, relax. Let's see. You might have a little bruise here in this lower lip. But what I tell the patients is not to put no makeup for 24 hours, no alcohol for 24 hours, no heavy exercise for 24 hours. Back in the day when the gyms were open quite frequently, I mean, not all the gyms are open, but I didn't like people going into locker rooms because it seemed a little bit more. You do have a small scar under here, so maybe that contributed somewhat.
Got stitches.
Oh, okay, that's it then. Okay, perfect. All right, well, that's all of it, but it's still beautiful. And let me just open your mouth side. I'm just gonna do a little bit of massage. I usually ask the patients, do not touch your lips. In fact, try not to touch any of the filler, especially for at least 3 days. So let things settle. Only after 3 days, if someone noticed something that was a little bit more raised up than another area, then you can do a little massage. The majority of my patients tell me they never have to touch anything. So So this is just helping to smooth it out. Open up one more time. Perfect. Let me put, so I'm gonna put a little arnica cream on and just do one final massage. I like to massage. I'm not massaging big time. I mean, I do a little bit up here. I like to do a little pressure. I tell patients, especially when I'm doing cheek filler, I like for them to sleep on their back for the first 2 nights, you know, as much as possible. If they find that that's almost next to impossible, then maybe take a child's blanket or a small towel and put it around the neck, so at least if they turn over, they won't necessarily smash their face into the pillow. So I'm just kind of smoothing out the filler. Nice. And all of this, generally, people won't need to do anything. Now sometimes in this right area here, this soft tissue filler I put to help create lift, sometimes people will notice, oh, it's a little wavy or whatever. The filler, the lines of product that I've laid out, they mesh together over the next few days. So even anything like there, I usually have patients don't touch it. I don't like patients using a Clarisonic face brush for 2 weeks, especially when I'm doing like cheek filler, where some people will try to get in and do real deep cleaning, and I don't want them to move anything around. Don't have to massage anything. Patients ask me all the time, so should I massage it? No. And when you go wash your face with your hands, you're going to fill the filler. I mean, you're going to fill, it feels firm. That's okay. You don't look firm, just leave it alone. It will soften over the course of a couple of weeks. So, but you don't have to rub it. If people rub it, then they're going to disperse the filler away from what it's doing. Just let it do its magic. It's just, you look gorgeous. I do like people, when they've done the lip fillers, not to drink from straws, or the sports bottles, the type that have the nipple where you wrap your lips around it, for 2 weeks. And lots of water over the next 2 days, lots of water, just to hydrate everything, all the fillers, all of these that are water-loving fillers. So let's see, what else? Anything else? Sleeping on your back, lots of fluids, don't have to touch anything. I want you to let me know if you develop severe pain. I'm talking severe pain. That is not normal. I've never had anyone have to tell me that, but I want people to know that. Gorgeous. She'll be numb for about 2 hours because of the lidocaine that's in the filler, but then that'll wear off and it'll be a little achy. Patients tell me then that sometimes, especially at night, they're trying to go, they might take maybe an Advil or a Aleve or Tylenol, which, thank you, this leads me into something else. So after the injection, it's okay to take that. But 7 to 10 days prior to the injection, no Advil, Aleve, Motrin, any type of ibuprofen, aspirin. I ask patients to avoid those types of medications. It can just increase the chance of bruising. And also supplements that are heart healthy supplements, fish oil, high dose vitamin E, ginseng, ginkgo biloba, garlic, green tea extract, all of those things, a lot of the G's, for instance, they seem to increase the risk of bruising. But you look good. I don't see any significant bruising. Good. Oh, the other thing about the lips, I like people to keep their lips moist. If you have a favorite chapstick you like, I want you to wipe it off with alcohol before you use it each time, for about 24 hours, just to keep it clean. All right, let me have you sit up one last time and let's take a look at that. I'll get this back. You feel okay though?
Yeah.
You did beautiful.
Great. Thank you.
She did so good. That was a lot. That was a lot. Look at you, and let me let you take a look in the mirror. Perfect.
Oh my goodness.
What do you notice? What stands out for you the most?
My lips and my cheeks, probably.
Beautiful. The lift,
And the less lines there.
the marionettes. Yeah,
Mm-hmm. Oh yeah.
gorgeous. You really do look beautiful.
Thank
All
you.
right. Well, I guess that's it. Hope you enjoyed the video session with myself, Dr. Covey, and Tammy. And I hope to see you at the spa soon. Bye-bye.